Hi, welcome to Tune to Health, a health awareness channel. Today we'll discuss the warning signs of cervical cancer that can't be ignored. Understanding these signs is crucial for timely intervention and effective management. By the end of this video, you'll learn the key symptoms of cervical cancer, how to take action if you suspect them, and tips to protect your body from complications. We'll also provide practical advice on preventing cervical cancer. Before starting the video, please subscribe to our Tune to Health channel. Hit the bell icon to stay tuned for more health-related videos. Remember, this channel does not offer medical advice. These videos and all comments and messages are provided solely for educational purposes and are not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your doctor or other qualified healthcare professionals if you have any health-related questions or concerns. Cervical cancer arises from the cells of the cervix, the lower part of the uterus that connects to the vagina. It's primarily caused by persistent infection with high-risk types of human papillomavirus, HPV, a common sexually transmitted virus. The progression from HPV infection to cervical cancer typically involves a series of changes in the cervical cells. Risk factors for cervical cancer include multiple sexual partners, early sexual activity, smoking, and a weakened immune system. Cervical cancer can present itself with many signs and symptoms. Here are 10 warning signs of cervical cancer. 1. Vaginal bleeding. Abdominal vaginal bleeding is a key warning sign of cervical cancer. This can manifest as bleeding between menstrual periods, after sexual intercourse, or postmenopausal bleeding. Such bleeding often occurs due to cancerous cells disrupting normal blood flow in the cervix. It's crucial to take any instance of irregular bleeding seriously and seek medical evaluation. Persistent or unusual bleeding could indicate the presence of cervical cancer or other serious conditions. If you experience any form of abnormal bleeding, especially if it's sudden or unexplained, consult a healthcare provider to determine the cause. 2. Vaginal discharge. Unusual vaginal discharge can be an important warning sign of cervical cancer. This discharge may become heavier, more watery, or develop a strong, unpleasant odor. Changes in discharge can occur as cancerous cells cause alterations in the cervical mucus or lead to infection. It's essential to monitor any persistent or abnormal discharge. Diagnostic evaluation often includes a pelvic exam and laboratory tests, such as Pap smears or HPV tests, to determine the cause. Persistent or abnormal discharge should not be ignored, as it could be indicative of cervical cancer or other gynecological conditions. Early diagnosis through medical consultation is crucial for effective management. 3. Pelvic pain. Persistent pelvic pain can be a sign of cervical cancer, particularly if it's new or worsening and not related to your menstrual cycle. This type of pain often results from the spread of cancer to nearby issues or organs, causing discomfort and pressure. Pelvic pain may be dull, sharp, or cramp-like and can affect your daily life. It's important to seek medical attention if you experience persistent pelvic pain that doesn't improve with typical treatments. A healthcare provider will conduct a thorough evaluation, including imaging studies and possibly a biopsy. 4. Pain during intercourse. Pain during sexual intercourse, known as dyspareunia, can be a symptom of cervical cancer. This discomfort is often caused by tumors or lesions in the cervix, which can lead to pain or a sensation of pressure during sex. If you experience persistent pain during intercourse that does not seem to be related to other factors like dryness or infection, it's important to consult a healthcare provider. Addressing this symptom early can lead to a more accurate diagnosis and improve overall quality of life. 5. Unexplained weight loss. Unexplained weight loss can be a significant warning sign of advanced cervical cancer. As cancer progresses, it may cause systemic effects such as loss of appetite, nausea, or metabolic changes, leading to weight reduction. If you experience significant weight loss without changes in diet or physical activity, it's essential to seek medical evaluation. A healthcare provider will conduct a thorough assessment, including blood tests and imaging studies, to determine the underlying cause of the weight loss. 6. Fatigue. Chronic and unexplained fatigue, not relieved by rest, may be a sign of cervical cancer. Persistent tiredness can result from the body's response to cancer, including anemia, chronic inflammation, or the side effects of cancer treatments. This fatigue can impact daily functioning and overall quality of life. If you experience ongoing fatigue with no clear cause, it's important to consult a healthcare provider. A comprehensive evaluation, including blood tests and imaging, can help determine whether the fatigue is related to cervical cancer or another health condition. Addressing fatigue early can aid in diagnosing and managing any underlying issues effectively. 7. Swollen lymph nodes. Swelling of the lymph nodes in the pelvic area or groin can be an indicator that cervical cancer has spread. Cancer cells from the cervix may migrate to nearby lymph nodes, causing them to become enlarged and tender. This swelling is often associated with cancer progression and should be evaluated by your healthcare provider. Diagnostic imaging, such as CT scans or ultrasounds, and possibly a biopsy, can be used to assess the extent of cancer spread. Identifying swollen lymph nodes early can assist in determining the appropriate treatment plan and managing disease more effectively, improving the overall prognosis. 8. Urinary tract infections, UTIs. Recurrent urinary tract infections that do not respond to standard treatment can sometimes indicate cervical cancer. The proximity of the cervix to the urinary tract means that cancerous growths can affect or spread to the urinary system, leading to frequent infections. If you experience persistent UTIs despite appropriate treatment, it's important to seek further medical evaluation. Diagnostic tests, including urine analysis and imaging studies, can help determine if recurrent infections are related to cervical cancer. Early identification and treatment are essential for addressing any underlying issues and preventing further complications. 9. Lower back pain. Persistent lower back pain, especially if it's new or a worsening symptom, may signal advanced cervical cancer. This discomfort can result from cancer spreading to the pelvic bones or nearby structures, causing pressure and pain in the lower back. If you experience persistent back pain that does not improve with typical treatments or is accompanied by other symptoms, it's crucial to consult a healthcare provider. A thorough evaluation, including imaging studies and diagnostic tests, can help determine if the back pain is related to cervical cancer and guide appropriate management strategies. 10. Increased urinary frequency. An increase in urinary frequency or urgency can be a sign of cervical cancer. Tumors or growths in the cervix can exert pressure on the bladder or surrounding structures, leading to more frequent and urgent urination. If you notice a significant change in your urination habits, especially if it's accompanied by pain or discomfort, seek medical evaluation. Diagnostic tests, including imaging studies and possibly urodynamic tests, can help determine if cervical cancer is affecting urinary function. Cervical cancer can be detected early through regular screening tests like pap smears or HPV tests. Vaccination against HPV has proven highly effective in reducing the incidence of cervical cancer. Early detection and treatment significantly improve the prognosis, making regular screening and vaccination vital components of cervical cancer prevention. By recognizing these signs, you can take proactive steps for early diagnosis and effective management of cervical cancer. Thank you so much for watching this video. Don't forget to follow us for more helpful content. If you liked the video, please subscribe to the channel and give it a thumbs up.